Hello and welcome to NewsFirst Prime. This is Archana. As a part of AI4Care Summit, we have Mr. Balasubramanian, who is the President and CEO of Thryve Digital. Hello, sir. Welcome.
Thank you for having me.
So we were actually just talking about this. You said your primary focus is US. So how are you trying to bridge gap between a developed nation and a developing nation?
I think India, as one of the foremost developing nation around, has immense potential to not only learn what has gone right from the developed nations, but also what has gone wrong there in the developed nations. For us to leapfrog the innovation cycle, just like we did in the digital payment space, where we were nowhere, and suddenly we are world leaders in that space, or even the telecom revolution, wherein we skipped probably 3G and went from 2G to 4G directly. So I think it's the learnings from the innovation dollars that have been spent in the developed nations, which we don't have to spend now to learn from them.
So how are you planning to take it to the rural India?
I think rural India, the need for healthcare transformation is the highest within India. Uh, I think we are fortunate in many respects. Our healthcare system allows us access to physicians in an unprecedented manner, which I think even the developed nations do not have access like that. For example, if you have a condition in the UK, if you have the National Health Service, they might say, it might take you 7 months to see a specialist. And which is the reason why medical tourism is on the rise in all the developed nations. As far as India goes, AI is transforming healthcare as we know it. So, healthcare in the next 4 or 5 years is going to be very different from where it is today through the deployment of technological advances that are powered by AI. So, if you look at rural India, the access challenges exist today, the connectivity and bandwidth challenges exist today, wherein the connectivity might not be 5G, might not be the sharpest and the most bandwidth available, uh, and of course the core issue is that there are not enough clinicians in India who can service the 700 million people who are in rural India and who desperately need access to care. So, when you look at technology advances, telemedicine, remote care, access to AI engines that can help identify issues proactively, that will help, for example, the people, patients, not just in rural India, but also in urban India, take care of their holistic health much better. And AI is going to change this for us. It's a game changer.